before performing the Leopold's maneuver, I have to perform few activities. So first, I will wash my hand. I will provide the privacy to the patient. I put on the curtains for privacy. So good afternoon, mom. How are you doing? I'm Nurse Pujarai, assigned to perform your Leopold's maneuver today. So, ma'am, may I know your name and date of birth? Thank you, ma'am. So, you must be very anxious about the procedure. Why do we perform the Leopold's maneuver? So, I would like to explain the purpose of Leopold's maneuver. The purpose of the Leopold's maneuver is to determine the fetal presentation and position by systematically palpating the abdomen of the pregnant mother, like your mom. So, I would like to ask, while doing performing the maneuver, I have to uh, touch your stomach. Is it okay with you, mom? Thank you, mom. So before doing this Leopold's maneuver, you have to empty your bladder, because you have to empty your bladder so that you will feel comfortable while I palpate the your abdomen. So, and the fetal position is also contour, or the position of the fetal is also not obscure. So my client is already emptied her bladder, so I will position her in a dorsal recumbent supine with knee flexed to ease the abdomen muscle. Now I will put the small pillow under her head, so to provide her the comfortable position, to provide her comfort. Now I will direct the patient. I will only expose the area which is required for the Leopold's maneuver on that only her abdominal part, to provide her more privacy. Before doing these procedures, I will rub my hands together to make it warm, because the cold hand can stimulate the uterine contraction. So whenever I perform, I will always warm my hand. Now I will measure the fundal height with my measuring tape. Fundal height is always measured in centimeter from pubis symphysis to fundal area. So I will measure from pubis symphysis to fundal area. So my patient's fundal height is 16 centimeter. We measure from pubis symphysis to fundal area, because the baby grows from uterus and until it reaches to gyphate process, reduce below, because the baby's head comes in the pelvis area and ready for the birthing process. So I will always use my palm for palpating, not my fingers. So the first maneuver is called the fundal grip. For that, I will face towards the mom face, and I will rub my hands and make it warm, and I will place both of my hands on the fundal area of the mom. So I will feel for the fetal parts, if there is a head or the buttocks. The purpose of this maneuver is to determine the fetal presentation. If there is a head on the fundal area, then it is big, firm, and have an independent movement. If there is a buttocks of the fetal, then it is a squishy, small, and move with the other body parts. So my second maneuver is called the uh, umbilical grip. So for that, I will use both of my hands and place on the opposite side of the mom's abdomen. And for in this process, one hand has to be steady and supporting the abdomen, whether and the other hand should be in a motion. So for this maneuver, I will keep my left hand on steady motion, and my right hand on a circular motion. For this, I will make a deep but gentle pressure from top to the lower abdomen of the mom, and then in a circular motion, I will palpate from up to down. And I will repeat the same process on my left hand. Then my right hand will be supporting the mom's abdomen, and I will provide the deep but gentle pressure in a circular motion, and I will feel for the fetal back or the extremities. So purpose of this maneuver is to determine the fetal back and the extremities. So if there is a fetal back, then it is long, firm, and gives a curvage of the shape. If there is a extremities, then it's small and gives a round shape. So this maneuver is very important for detecting the fetal heart tones, because we on the back part or portion of the baby, we detect for the fetal heart tones. So we use the Pinard's stethoscope or the Doppler's transducer for the fetal heart tones, to detect the fetal heart tones, whether the baby is having reg, a normal heartbeat or not. So my third maneuver is called the Pollick's grip. For that, I will use my thumb and the index finger, and I will put my fingers above the pubis symphysis, and I will provide a gentle drip pressure and try to move from side to side. The purpose of this maneuver is to determine the engagement of the fetal head. If there is a movement, then fetal head is not engaged, and if there is a no movement, then fetal head is engaged, means the fetal head is already in the uh, inlet of the mother's pelvis, and if there is a movement, then fetal head is floating and it's in outlet of the mother pelvis. The fourth member is called the pelvic grip. For this, I will face towards mom feet, and I will put my three finger tips on mom's meningeal ligament 2 centimeter from the meningeal ligament, and I will provide a pressure downwards towards the pelvis. The purpose of this maneuver is to determine the degree of flexion of fetal head or the fetal attitude. Now I will confirm the fetal presentation, whether the baby's head, shoulder, or buttocks line on the mother's pelvic area, and I will document the significant finding, whether the fetal presentation is normal or abnormal.